Welcome back to the deep dive. Ready to dive into another complex healthcare topic?
Always. What do we got today?
Today, it's all about prior authorization and Medicare Advantage. I mean, it's a system that can really have a big impact on whether you get the care you need when you need it.
Yeah, it's kind of this weird balancing act, right? Like Medicare Advantage, it's got all these extra perks and benefits, but then you get hit with this prior authorization process, and it just throws a wrench in the works. For doctors, for patients, it's a mess.
It is. And you know what? We've got this really eye-opening story from Dr. Bruce Scott. He's the president of the American Medical Association, and he was trying to get a CT scan authorized for a patient. The patient had a tumor in their voice box. Seems pretty straightforward, right?
Oh yeah, you mean that story where the insurance reviewer had no clue about basic anatomy?
Exactly. Like imagine being a doctor, years of experience, and you have to argue with someone who doesn't even know where the voice box is, all while your patient is just waiting for care. It's mind-boggling.
It really is.
Yeah.
And it really highlights how prior authorization, when it goes wrong, it's not just a bureaucratic headache, right? It can
Right.
actually be dangerous,
Yeah,
harmful to patients.
absolutely. And this isn't just like a one-off anecdote, right? We've got a whole stack of research articles, reports, even some interesting stuff from a podcast called Appeals Pro Podcast, and they all point to the same issue. Prior authorization is becoming a major pain point in Medicare Advantage.
It's pretty wild. It's like this system that was supposed to control costs and make sure people get the right care has just become this giant roadblock. It's actually hindering those goals.
Okay, so for our listeners who maybe aren't as familiar with the Medicare Advantage, let's do a super quick recap. Basically, it's like a private insurance alternative to traditional Medicare.
Mm.
People over 65 or with disabilities can enroll.
Yeah. And it's getting super popular. I mean, almost half of all Medicare beneficiaries are now in these Medicare Advantage plans.
So what's driving the surge? Why are so many people choosing these plans?
Well, there are a lot of reasons. I mean, the extra benefits are a big one. Things like dental, vision, hearing. Some plans even cover things like meal delivery or pest control. It's like getting a bonus package on top of your regular Medicare.
Yeah, those perks are definitely attractive. And then you've got the peace of mind of knowing that your out-of-pocket costs are capped. So you know you're not going to get hit with some huge bill if you get sick.
Right. It's about predictability, protection from those really big medical expenses. And I mean, it seems like people are pretty happy with their plans overall. J.D. Power did this big Medicare Advantage study and found that satisfaction rates are generally pretty high.
Okay, but that makes me wonder, are these surveys really getting the full picture? Like, are they capturing the experiences of people who've actually had to deal with this prior authorization nightmare?
That's a good question, right?
Mm.
We have to be a little skeptical of those satisfaction scores.
Mm.
Are they really representative of everyone's experience, especially the people who've faced delays or denials?
And I'm also curious about how the structure of Medicare Advantage itself might be influencing those scores. Like these plans, they're evaluated based on quality ratings, right? They compete with each other.
Exactly. So they've got this built-in incentive to keep their members happy and healthy,
Hmm.
which is good. It's a quality control thing. But it also makes you wonder if the focus on satisfaction might be overshadowing some other important concerns.
Like the impact on the doctor-patient relationship.
Right. It's not just about numbers, it's about people. How does this whole prior authorization system affect the trust and communication between doctors and their patients?
And how much is it contributing to physician burnout? I mean, imagine spending hours on the phone battling with insurance reviewers who don't understand basic anatomy.
It's a recipe for frustration, for sure. And when doctors are burned out, the quality of care suffers. We're seeing some pretty scary stats about doctors thinking about early retirement or even leaving medicine altogether because of this kind of administrative burden.
That's a huge problem. So, okay, we've got these appealing aspects of Medicare Advantage, the extra benefits, the cost predictability, but then there's this dark side, this prior authorization mess that's causing all sorts of problems.
And it's not just theoretical. Studies are showing that delays in care because of prior authorization, it can have really serious consequences.
Yeah.
Hospitalizations, disabilities, even death. It's that serious.
Okay, so this is getting a little heavy. Let's shift gears for a minute. Before we spiral into despair, let's talk about what's being done to address this.
Okay, so we've got this prior authorization system causing all kinds of chaos in Medicare Advantage. Is anyone actually trying to fix this?
Well, there is actually some good news. There's this bipartisan bill. It's called the Improving Seniors Timely Access to Care Act, and it's moving through Congress right now. And get this, it specifically targets prior authorization reform in Medicare Advantage.
Bipartisan. Okay, that's a good sign. Sounds like both sides are acknowledging that there's a real problem here. So what exactly does this bill propose? It's got some really promising stuff in it. One of the key things is mandating an electronic prior authorization process. Like, picture this, a secure online portal where your doctor can submit those requests, they can track the progress, they can even get clear explanations if something's denied.
So, no more endless phone calls with the insurance company, no more wrestling with fax machines. That sounds like a dream come true for doctors.
Right, it would streamline everything, make it so much more efficient. And it's not just about convenience either. The bill also wants to increase transparency, so if a request is denied, you'll actually know why. No more vague answers or feeling like you're hitting a brick wall.
Yeah, transparency is so important. It can be incredibly frustrating when you feel like you're in the dark, not knowing why a treatment is being denied or what you can even do about it. What else is in this bill? Anything about those crazy wait times?
Oh yeah, it tackles that head on. It proposes faster turnaround times for those decisions. 72 hours for urgent requests, 7 days for non-urgent ones. No more waiting weeks or months while your health is on hold.
That would be huge. So it sounds like this bill has a real chance to make a difference. Is there a lot of support for it?
There is. A lot of medical organizations are really backing it. The American Medical Association, for example, they're big supporters. They see it as a crucial step towards improving patient care and helping with all that physician burnout we were talking about.
It's pretty powerful when the doctors themselves, the ones dealing with this broken system every day, they're the ones demanding change.
Absolutely. And it's not just the medical community. There's this group called the Regulatory Relief Coalition. They're all about reducing those administrative burdens in healthcare, and they're big fans of this bill too.
Makes sense. Prior authorization, it's just a classic example of red tape, right?
Mhm.
Adding cost, adding complexity without actually improving outcomes.
Exactly. And they see this bill as a way to save money, make things more efficient. It's a win-win, not just for doctors and patients, but for the whole healthcare system.
Okay, so we've got doctors on board, we've got administrative folks supporting it. But what about the insurance companies? Where do they stand on this whole prior authorization reform thing?
That's where things get a little more complicated. We've got some insights from the Alliance of Community Health Plans. They call it ACHP for short. They represent a lot of those community-based health plans that are participating in Medicare Advantage.
So are they ready to jump on the reform train?
Not so fast. They acknowledge that there are problems with prior authorization, but they're not super enthusiastic about the government stepping in.
I'm curious about their reasoning. Wouldn't they benefit from a more streamlined, efficient system too?
Their big worry is that too much regulation could stifle innovation in Medicare Advantage. They argue that these health plans need some flexibility to tailor their approaches, depending on the market, the population they're serving.
I can see that. A one-size-fits-all approach probably wouldn't work everywhere. You've got regional differences, different patient demographics.
Right. And they point out that some plans are already doing a better job with prior authorization than others. They highlight examples like Sanford Health Plan and Geisinger Health Plan. They apparently have way lower rates of prior authorization requests compared to the bigger national plans.
So it's not like all prior authorization is inherently evil. There are ways to do it better, and some plans are already figuring that out.
Exactly. And ACHB thinks that encouraging these best practices, fostering competition between plans, that's a better way to go than just imposing strict federal rules.
It makes me think about patient choice. If some plans are better at handling prior authorization, how do we help people choose the right plan?
That's such an important point. It's not enough just to have choices, right?
Yeah.
People need to understand what those choices actually mean, how it'll affect their health care. It really highlights the need for clear, unbiased information so people can choose plans that actually work for them.
So it sounds like we've got a lot of different perspectives here, valid arguments on all sides, no easy answers. But it seems like there's at least a growing awareness that the current prior authorization system is broken.
Yeah. It's not a question of if anymore. It's a question of how do we fix it?
Yeah.
And that's progress.
Right. This whole conversation has really emphasized how important it is to be an active participant in your healthcare. You can't just assume the system's going to take care of you.
Absolutely. You got to be proactive, ask questions, understand the consequences of those different choices.
So with all this talk about legislation and what different groups are saying, let's bring it back to the listener for a minute. What does this all mean for them, for their healthcare?
Yeah, that's the million-dollar question, right? It's easy to get lost in the weeds of policy and jargon. But at the end of the day, this is about people's lives, their health.
So let's cut through the noise. How does prior authorization in Medicare Advantage actually affect the listener's day-to-day healthcare experience?
Well, it can literally determine whether you get the treatment your doctor recommends. It can determine how long you have to wait for that treatment. It can even impact your out-of-pocket costs.
Yeah, this isn't some abstract debate. There are real-world consequences. Imagine needing a specific medication, a procedure. Your doctor says this is what you need, and then bam, you hit this prior authorization wall. It can be so frustrating, so disheartening, especially when you're dealing with a health issue.
Absolutely. And think about the families, the caregivers. They're often the ones navigating this whole mess, advocating for their loved ones, dealing with the emotional stress, the financial strain. It's a lot.
It really underscores how important it is to talk to your doctor, understand what your plan's policies are, what kind of questions should listeners be asking their doctors or insurance providers to make sure they're not blindsided by this.
Well, I think it's crucial to know what kinds of treatments usually require prior authorization.
Okay, so know what's likely to trigger this whole process. What else?
Ask about those turnaround times.
Yeah.
How long will you be waiting?
Because that waiting game can be brutal. Anything else they should be asking?
Find out about the appeals process. What if a request is denied? What can you do?
Knowledge is power, right? The more you understand, the better equipped you are to fight for yourself, for your loved ones.
Exactly. And remember, you have a voice. Don't be afraid to use it. Ask questions. Demand answers. This is your healthcare. You deserve to be in control.
Okay, so we've covered a lot here. We've talked about prior authorization itself, what it means for Medicare Advantage. What are the key takeaways for our listeners as we wrap up this part of the deep dive?
I think the biggest thing is Medicare Advantage, it's not a perfect solution for everyone. It's got its pros, definitely, but there are potential downsides too, prior authorization being a big one.
Yeah. It's not just about the fancy brochures and promises of extra benefits. It's about understanding how the system actually works, how it could affect your access to care.
Right. And things are changing all the time. We've got this legislation that could change everything. We've got health plans trying new things.
It's a constantly evolving landscape. Staying informed is so crucial. So what does that look like?
Well, if you're thinking about Medicare, do your research. Compare plans. Ask the right questions.
And if you're already in a Medicare Advantage plan, know your plan's rules, know your rights, be ready to advocate for yourself if you run into problems.
You got it. Knowledge is power, especially when it comes to your health.
Before we move on to the final part of this deep dive, take a minute to think about what we've talked about. What resonated with you? What questions are you still wrestling with?
We'll be back soon to explore some potential solutions, give you even more information, and leave you with some things to think about as you navigate this whole crazy world of healthcare.
Welcome back to the deep dive. We've been exploring this whole world of prior authorization and Medicare Advantage, and I don't know about you, but I'm ready for some solutions.
I hear you. It's a lot to unpack, but, I think we've done a pretty good job of laying out the issues, the potential impact on people's healthcare choices.
Right. We've heard from doctors, we've heard from insurance companies. We've even got this glimmer of hope with that bill in Congress.
Yeah, the Improving Seniors Timely Access to Care Act. If it passes, I really think it could be a big deal. I mean, imagine prior authorization that's actually, efficient,
Yeah.
transparent, focused on getting people the care they need.
Then a nice thought, but let's be real. Even if this bill becomes law, it's not going to fix everything overnight.
True, but it's a step in the right direction. And in the meantime, there are definitely things people can do to navigate this system to protect themselves.
Okay, so let's talk about that empowerment time. What can our listeners do to avoid getting caught in this prior authorization trap?
Well, the number one thing is knowledge. You got to know the rules of the game. Familiarize yourself with your plan's specific policies on prior authorization. Like what kinds of treatments usually need approval? How long does it take to get a decision? What if they say no? What are your options?
Right. And don't be afraid to ask your doctor, your insurance company. They're not always going to volunteer this info, so you have to ask.
You do. And remember, you're not alone in this. There are organizations out there that can help, like the Medicare Rights Center. They can give you guidance support if you're having trouble.
So there's help if you need it. But let's zoom out for a minute. We've talked about solutions within the existing system, but is there a way to rethink healthcare entirely so we don't even need prior authorization?
It's a big question, right? Kind of a utopian vision. But I think it's worth thinking about. What would a truly patient-centered healthcare system look like?
Okay, let's put on our visionary hats for a second. If we were designing a system from scratch, how would we handle prior authorization?
Well, I think it starts with trust. A system where doctors are trusted to make the right calls, where patients are empowered to make decisions with their healthcare providers.
So less about gatekeeping and more about working together.
Exactly. And imagine a system that uses technology to its full potential. We've got electronic health records, but what if everything was connected? Seamless, easy to access for both patients and doctors?
No more faxes, no more phone calls. Everything's just right there.
Right. And imagine that data being used to actually improve care, not just to control costs. Real-time information about treatments, outcomes, personalized recommendations based on your health history.
It's like healthcare nirvana. But how do we actually get there, from where we are now to this ideal system?
It's a long road, no doubt. But I think the first step is a mindset shift. We have to move away from this adversarial bureaucratic approach. Healthcare needs to be more collaborative, more focused on the patient.
It's a culture change, not just a policy change.
Absolutely. Healthcare should be a right, not a commodity. It's about putting patients first, giving them the power to be active participants in their own health.
That's what this whole deep dive has been about, right? Giving you the knowledge, the tools to do just that.
We've explored this whole messy world of prior authorization. We've looked at the problems, the steps you can take to protect yourself.
But we've also challenged you to think bigger, to envision a better future for healthcare.
So as we wrap up, we leave you with this. What role will you play in shaping that future? Will you accept the status quo, or will you demand better?
It's a question worth thinking about, and we hope that this deep dive has given you the information, the inspiration to answer it. Thanks for joining us on the deep dive.
Stay curious, stay informed, and we'll see you next time.